Welcome to VedhikaTV viewers. Let us talk to Dr. Moonot. Hello, doctor.
Hello.
We do strengthening for our muscles, mainly concentrating on the upper body, but we neglect our joints or the lower foot and ankle. So, what kind of exercises or routine we should take in order to avoid such kind of injuries?
What I would suggest is people who are starting to get into some form of exercises, and always, most of the people, and especially younger people, always first thing they go is strengthening exercise. As you rightly said, upper body is strengthening, biceps, triceps, back, you have to do strengthening. I see a lot of my people as well coming with knees, they will go for thigh bench presses, calf raises, and all that stuff. However, as we age, we lose elasticity of muscle, okay, especially after the age of 35 and 40. So what we need to do is we need to stretch. Okay, so stretching is very, very important. Your hamstrings, which can over a period of time get tightened, your gluteus muscles, so the buttock muscles, hamstring muscles, your calf muscles, they become tight. So before you do any workouts, stretching of the muscles is very, very important. Having a good warm up is very, very important. And then you can do whatever work you want. You want to do bench presses, you want to do squats, you want to do lunges, all are fine. But listen to your body and always start slowly. That is the mantra. Always start slowly, and every week only increase your workload by 10 to 15%, not more than that. I get a lot of people saying day one or first week, or first few days they started with 20-minute walk. Next week they started with 45-minute walk, and they behold, they come with pain. Don't do that. Always gradually increase your workload, stretching or warm ups, do your workload, and then again warm down. So again end it with stretching and icing. Those are the few things which you should take care of yourself, and I'm sure you will enjoy your
So,
workouts.
we generally choose footwear which is stylish rather than comfort. So, how does this footwear plays a role in this joint pains or ankle or foot injuries?
And this is from a personal experience. My wife, one day when we moved from London, after a year, she said, let's go for shopping. And we were looking at getting a footwear for the Indian attire. And I scaled through the big super mall in Mumbai, and I could not get any good footwear, and this I'm talking a few years back, of course, which was comfortable, biomechanically sound, but at the same time looking stylish. Okay, so you cannot, and I was like, why is there such a big gap
So, we
between
will
this?
not get that combination of comfort and
Yes,
stylish.
yes. So something which is good, your foot should be able to be comfortable where you can spend the whole day in it if you wish to, and the same time should look good. That combination is very rare. Even now I can tell you it's very rare. Okay, it's got better, but it's not common. Because most of the time the footwear was just a thin half a centimeter sole, two straps on the top which have a lot of embroideries of or diamonds dazzled on that. That's not a good footwear, because understand, your footwear should be holding to your feet and not your foot or your toes continuously holding your footwear. Because if that is the case, that means all your muscles are continuously active, and over a very short period of time you will start getting tired. Okay, also the other thing is, when you're buying a footwear, make sure you have a nice 1 to 2 centimeter of sole which is comfortable, which is actually taking the pressure off or taking the load and giving a good ground reaction force to it. Also, you need to make sure that it has multiple straps, right, at the front and at the back if it can support it. One more thing which I observe when I travel a lot of women try it, always will be half a size smaller. It's always. And key thing is your footwear or the inside of your chappal or a footwear should be all around your foot. So your heel should not be hanging out of your chappal or your sandal. Okay, that's another common mistake. Also understand what type of foot you have. Do you have a normal aligned foot? You have a flat foot, or you have a very high arch? And those are very easy tests to, and we will show you how you can test it, what type of footwear you have, and get those type of shoes if you want. So you have different types of shoes for flat foot, high arch, and a normal foot. Also, what activities you want your shoes or your footwear for. If you want for running, is different. For walking is different. For any sports is different. So understand. So buy a correct footwear for your activities as well. two last things I would say. When do you buy your footwear? Never buy it in the evening. Okay, because by evening your foot is slightly swollen, so you always may buy a size bigger. If you buy it in the morning, there is no swelling, so it will be shorter. The best time to buy a footwear is in the afternoon or very early evening, so you get the right size. And the last thing is, when you're wearing your footwear, and especially a closed footwear, your great or toes, which are the longest toes, should still have a half centimeter to wiggle inside your footwear. That's very important. Just don't go and buy something which is very attractive, on sale. Try to see if it is half a size smaller, you still be able to wriggle out. No, don't break into a shoe. Okay. And other thing, always try both sides. You will find that there is always a slide. One side of your foot is smaller than the other. Okay, always try both foot, both sides. Walk for 5 minutes. You should be comfortable. Then buy it.
So as you said about the footwear, I just want to add to it, like we women wear heels continuously. Like from the early age, we start wearing heels for any kind of occasion or to the office or anywhere. We love to wear heels because it enlightens our confidence also. So how will it affect our legs in the long run?
The psychological impact which has is phenomenal. Till date, I have not told any of my patients don't wear heels. Wear heels, but try to spend as minimal time as possible in the heels, especially if you're wearing stilettos. Long stilettos, be very careful, and always have few different pairs of heels with different sizes. Okay, so you could have a 2 inch, you could have a 1 inch, and you can have a 4 inch, but vary it. Shortest period of time spent on that, and do calf stretches. That's very, very important, because if you wear heels for a very long period of time, your calf will get short, they will get tight, and then you will have problems. So that's one thing for the heels. The second part is, along with the heels comes always a narrow toes. So narrow toes gives you a big problem, called as a bunion, also called as hallux valgus. Okay, because the toes are pushing, the front part is pushing all the toes, crowding together. It's a big issue. In the western side, narrow toe heel shoes is the most common cause of bunions. In India, not so much. Yes, I'm seeing the big surge of patients with bunions in my practice coming for treatment. But one of the other causes of bunions in India is probably genetics or ligament laxities, which I've already spoken about. Now, what do we do with it? Do you treat? Tell the people don't wear it? Or do you see some do some other treatment? In India, most of the time, women, men, they go around it, change your footwear, try to wear open sandals, chappals, and they do not seek treatment. So that's why mild bunions to moderate bunions, people coming to seek treatment is very low, and having surgery is still very low. In the western side, I think most of the people with mild and moderate bunions, they have surgeries, full stop, because of the weather conditions, because of work conditions, and etc. India is slightly different, as I said. People go around it, but when you start getting one toe over the other, so the great toe coming over the second toe, or the second toe coming over the first toe, that is where people start getting problems, because then you can't wear footwear, you can't wear open footwear. If you want to travel, you want to wear a closed footwear, you will start getting corns. Also, you get a lot of callosities on the inside. That is the time people come to me and they said, I need something to be done. And I think that is the time to have surgery done, definitely. Now, what types of surgeries? Now, you do not need to lose the mobility. You can also have a corrections called as a bunion correction surgeries. Do for this. Now, before that, just reminded, I remembered, and a lot of things happening on Instagram on this. You have these fancy socks or splints for bunions. They do not work. I am not paid a consultant for anybody. They do not work. Okay. Yes, when you wear it, it will be straight. It looks straight. The moment you stop using it, it will go back to its place. Okay. If you say I will wear 3 months, 24/7, 365, no, it will not work. That's literature, not new. It's been there in the literature. It does not work. So as I tell all my patients, either you live with it, work around it, or have surgeries. That's what it is. So when you have surgeries, initially I should do big open surgeries, break the bones, realign the bones, tighten the tissues, everything. Did well, recurrence rate of around 5% to 10% in 3 years to 5 years. But now, as I was talking about initially, I do minimally invasive surgeries, 2 or 3 cuts less than a centimeter. I can correct the whole bunion. They can walk from day one. There is no plaster. Now my patients having minimally invasive surgeries for bunions or anything need plaster. They can walk on heels from day one, and the outcome is very good. Okay, you can correct all the deformities of the bunion in the same thing. We have special screws which can fix it. The pain is less, mobility is better, outcomes are better. Also, literature suggests the recurrence rate, that means to have it back, is low as of now. So, it has revolutionized my treatment of bunions for patients with severe deformities. Now, there are some patients with severe deformities crossing over third toe, fourth toe with arthritis. In those patients, yes, you can still correct it, but sometimes you will need to sacrifice the joint. But it is still better than having a toe with claw toes, with corns, which gets infected, and then you need to lose that toe. So, I think if they're symptomatic, they should be treated appropriately.
Thank you so much, doctor, for sharing us this valuable information. Thank you once again.
Thank you so much for having me on this show. I hope the viewers have found all the information useful. If there's anything, they can always contact us. Thank you.